It's just me. I think I ate a lot. Now I feel really
Marco?
also because I ate the temper.
Mm.
And it was so salty or
Um.
Shanti.
I'm Shanti. Can you hear me?
Yeah, I can hear.
Ah, okay. Okay, good.
So let's begin the session. Come into the sitting posture. Keep your back neck straight, aligned. Gently close your eyes. Go into your asana. Observe the alignment, how you are sitting. Now, once you are comfortable, move your attention towards your natural breath, the breath which is going in and coming out. Now, take a deep, prolonged, slow inhalation, deep, prolonged, slow exhalation. Now, inhale for the 3-time Om. Take a deep breath. Om. Om. Shanti, Shanti, Shanti. Feel the vibration and sensation. Join your both palms, tap your palm. Place on your eyes. Feel the warmness. Very slowly while blinking, looking at your palm gently. Open up your eyes with a big smile. Put hand and say Om Shanti. Om Shanti. So till now we discussed about the arthritis problem, right? Uh, in previous session we talked about that what are the causes of the arthritis, and we talked about the diet part, especially for the arthritis, what they have to take it. Now diet for the other problems, vata related problems, as we discussed that the bone related disease mostly happen due to the imbalance in the vata. Okay, so if you have spondylitis, disc herniation issues, where your disc is bulged out and start pressing the sciatica nerve or other nerves, and then you feel the numbness in your leg, one side of the leg, and spondylitis, you feel the numbness in your hands. Okay, the neck issues, lower lumbar issues, back problem, back ache. These are the other common issues, which I think everybody, I cannot say once in our lifetime, we go through these problems. Why we are having these common problems? The main reason of that is long-term sitting posture, and that is wrong posture. Even standing posture, or we are doing the forward bending to pick up some heavy weight, and due to that we get the lower lumbar issues, even spondylitis, and people are sitting like this, making like this, and using the finger desk job, uh, using the finger for writing 8-9 hours. They're just sitting on the chair, not doing the most of the movements. So this is the main reason. There's other reason as well, but this is the main reason you get the spinal disorders, spinal problems anywhere. That we can correct, that we can come out when we are correcting our posture. Posture play very important role, especially whenever you're sitting in the wrong posture, you're giving the wrong pressure to your other muscles, other nerves, other tendons, fascia, and then you get the problems related to that. And in modern therapy, we have the surgery, but understand once you get into the surgery, then even you're never going to correct your sitting posture, right? And surgery would not be a solution. It would be the last option. And spinal is a very, very, fragile part of your body. If any nerve, unfortunately, cut or while performing the surgery, anything happened, unfortunately, that you can paralyze him. That is a worst condition can happen. Doctor, they take all the precaution every while performing the surgery, but again, unfortunately, anything can happen. So you have to make sure, if you have like very acute situation, surgery would be the last option for especially the disc herniation problems, sciatica problems, and lower lumbar region problems, spondylitis. Doctor prescribed that you have to go through the surgery because discs are bulge out and which giving the pressure to the nerves around that area. So try to prevent. It would be the last option. Don't go just okay. Doctor is saying so we have to go. Yoga therapy, and yes, physiotherapists work wonder on that. You can take the help of the physiotherapy and other naturopathy and help, which they give the massages. In Ayurveda, we have the massage for that, and Potli massage, providing the heat, stone massage, where we're putting the stones, the warm stone on that particular area, which take it out the pain. But these are the temporary things, and you have to take these therapies to quickly get the relief. But yes, if you're not correcting your posture, lifelong you cannot continue. You have to reverse this, right? So you have to correct the posture. Then diet for that. Arthritis patient, whatever they are having, same thing they can continue, but they include the other things as well. Brown rice, like arthritis, cannot have the brown rice, black rice even, but these people can include the brown rice, black rice in their diet. They can have wheat, but adding these spices, turmeric, cumin, ginger paste, garlic paste. Garlic is work wonders, especially strengthening the muscles, strengthening is anti-inflammatory, giving the strong and rich in many vitamins and minerals, right? And it's work wonder, especially the Vata related issues. So garlic you should include in your diet. Raw garlic also you can take empty stomach in the morning, that time with the as a medicine with the hot water, lukewarm water or hot water. That also reduce the watt in your body, okay? And strengthening your muscles, it's good for the heart even. But right now we're focusing on that, the watt related issues. So other spices you can add while making the chapati, and don't always make the fresh dough. Always use when you are making the chapati, always use fresh dough for that. Okay, don't use the previous night dough, or you're making the dough in the morning and then using in the night. Don't do these mistakes with the wheat flour or all the flour. Freshly make dough and then make the chapati. And yes, bread shouldn't be included in your diet, but you can have the chapati form of the dough. Wheat, millet, ragi flour, gram flour, these flour you can include in your diet. Corn flour also they can get. Okay? Citrus fruit, yes, they can have it. It's not giving so much harm. They can take all varieties of the fruits, but pineapple is good for them. Not taking too much. Less, sometime they can include in their diet. Arthritis completely boycott, but they can have. Yogurt, arthritis patient cannot have the yogurt, okay? But these people can go with the yogurt. Yogurt, best time early in the morning, empty stomach, adding the pinch of the limestone into it. Arthritis, they can have the pinch of the limestone in pomegranate juice. That's also strengthening their bones. It's good in the calcium, high in magnesium, and pomegranate juice is wonderful. It's rich in most of the things. Good for your increasing the blood regulation, maintaining the blood pressure, and increasing the red blood cells in the body, working on your immune system. Amazing, I can talk about it. So pomegranate, arthritis, any kind of pomegranate juice with lime pinch, just kind of wheat, kind of one grain of the rice. That much they have to put it, take it, empty stomach. These people, those who are having other problems of the bones, if they don't have stone, bladder stone, kidney stone, or gallbladder stone, they don't have tendency, and recently they have the stone and they go with the surgery. Still, they cannot take the limestone in their diet, and even any calcium supplement they should avoid it. Okay, because calcium deposit and in the body, in the arteries, and even because calcium body, if you have weaker Jataragni, calcium would not be absorbed by your body, and then it's gonna deposit in your arteries, it's gonna deposit in your organs, and then you get the stone issues. So even synthetic supplements you should avoid it. Calcium, yes, of course. If you don't have stone issues, yes, this is the best way. This is the best supplement for uh, maintaining the calcium in your body. If calcium, you maintain the calcium, rest of the minerals, vitamins, also your body gonna absorb. Okay, understand. So calcium one should include in their diet. Other things, they have to include the phosphorus, magnesium in their diet. For that, they can have flaxseed, ripened papaya, banana, lots of fruits they can include in their diet. Green leafy vegetables, rich green like spinach, broccoli they can have, but not too much. All cauliflower completely boycotted by the uh, arthritis patient, but here broccoli they can sometime they can roasted potato. Rest of the vegetables they can have freshly seasonal vegetable they can have pulses, soya, green, moong pulse they can include in their diet. Soya bean is good in the protein and rich in the calcium also. Coconut flesh they can take it, but noon time, okay, but not the morning time, not the evening time. But what arthritis patient completely well. But these they can have. Coconut is rich in the calcium also. Coconut milk also they can take it, but again noon time. Okay, not evening time, not the morning time. Again, adding the pinch of the turmeric, black pepper, dry ginger powder, boil it, little bit lukewarm it, and then you can have it. And make sure all the milk, vegan milk, which I'm talking about it has to be homemade, not the packet one. Clear? Then other milk which they can include in their diet, the walnut milk, oats milk, cashew nut milk, bucket buck bucket wheat bucket or bucket wheat, something like that. They can include in their diet. Morning and evening time bucket wheat milk. Again, same spices they have to add it. Have with the jaggery. Okay, natural sugar they can take with it. Then lots of ghee, A2 level cow, happy cow ghee they have to include, not cheese. I'm talking about the ghee. Okay, ghee is work wonder for balancing the bath. Bath is dry, and even bones become weakened. A2 level cow ghee has a rich in vitamin A, D, K, all those vitamins which is soluble. Uh, the the oil soluble, they are good, that present in the A2 level ghee. If you're vegan, you can have other forms of the oil: sesame oil, almond oil, argan oil, edible argan oil, and olive oil. These four on the top. you have to include in your diet. Now, rest of the thing they follow with the same routine which arthritis patient are taking it, but these they can include extra in their diet. Milk is very important. Fruits, banana is also good, and chiku, pomegranate, papaya, apple, and sometimes they can have citrus, but not. Onion, garlic, ginger, and carrot. Carrot is very good. Beetroot, these are the good vegetables. Spinach, most of the green leafy vegetables are good for them. Okay, and yes, gooseberry, uh, they can also include in their diet. So these things for the rest of the people diet. Now the arson, what kind of arson you're gonna introduce to them? Arthritis patient has to go with the swoosh vyam. Swoosh vyam is like subtle movement of the body. Subtle movements are Griva Shakti Vikasa Kriya is movement of the neck, like one side to the other side with the awareness of the breath. So how you gonna introduce? Inhale, and when you're exhaling, try to look at your back. Then again, inhale, come in middle, and then exhale. One Griva Shakti Vikasa Kriya, then second inhale and exhale. Inhale. So inhale and exhale. These are the one practice. Then the Maniban Shakti Vikasa Kriya, rotation of your wrist and clockwise, anti-clockwise. Then Angli Shakti Vikasa Kriya, where you are moving your fingers. So Kohini Shakti Vikasa, we have many names. Okay, just I'm not saying you have to remember the names of these sushmyam, but subtle practice of your synovial joints. But make sure you make that routine for your students, which include all the synovial joints. Okay, so movement of all synovial joints, major and minor. That kind of routine you have to make it. So from top of the head to tip of the toe, all the joints should be moved. And like sometimes we just like these things we don't include when we are doing Ashtanga vinyasa or vinyasa. So we are not giving the movement to these parts of our body. And these are very important parts of the body. If these joints are weak, you cannot make the big movements even. You cannot go for the jumping and other things. If your shoulder is weak, you cannot go for the chaturanga and other practice. If your wrist is weak, you cannot go for the plank pose. So give importance to um, these synovial joints and these minor joints of your body, and make sure it is not. I'm not talking about only for the people who are having problems, but even generally people whom you're gonna teach, you have to start your class with this, not just going into the sun salutation posture A and B and then start practicing the Ashtanga Vinyasa. Is the worst thing is happening in the modern time. People are crazy about the these flows of the practice, but they forget about the motto of the asana to keep your joints healthy, to keep your body healthy, not breaking them. Okay, ask yourself why you are practicing. So you improve the flexibility, you get the strength of even minor joints. So focus, it's these practice is suitable for everybody and best for the old people especially. You're not going to introduce these Ashtanga Vinyasa or Vinyasa for fast flow. They're going to break their body. But yes, if you're flexible and you have everything, your body fit, you can reduce the practice of Sushmya and you can practice more the other asanas. But always begin your class with these involving these tiny, small movement of your body, where neck rotation, wrist rotation, knee movement, your hip movement, very minor mind, and with along with the breath awareness. Now, after this, sun salutation you can introduce for them. Sun salutation A and B, very good. And balancing posture also you can include, but make sure understand the needs of your students. Okay, if they are going through certain problems, you have to modify that according to their needs. It is your responsibility that anyone who is attending your class not met with the injury. Okay, so make sure go with the safe side. Then come to the breathing practice. Yeah.
Sorry, we have change of plan with the Ashtanga class. Today it's 1 hour earlier, so I have to leave now, unfortunately.
Okay. Okay. You can leave.
Okay. See you on Monday.
So now so it's very much important that you should, follow these asanas and then introduce the breathing practice. Breathing practice which work on the deeper cellular level, which change even, the degeneration of the bones which happening to your body. Now you can reverse it. How? With the breath. Because oxygen, if you're giving the oxygen to your each and every cells gonna rejuvenate. Even bones cells gonna rejuvenate. So breathing practice you have to include in the practice whenever you are giving the class. 4 safe breathing practice, that is abdominal breathing, thoracic breathing, then yogic breathing, and nadi shodhan. These are the pre-practice of the pranayam you have to include it. These are the safe things. There's no not much precaution you have to take it. Okay. When we are talking about the pranayam, we have to take the more precaution, right? There's a precaution one should go through it, right? But these 4 practices are the safe practice. 15 minutes, at least 15 minutes one should practice. 2 hours morning and evening, because we are talking about those problems which is we don't have the cure, and forever you're gonna have this problem, and other body organs gonna affect by that. So it's very much important that you should dedicate your life to bring your health back. Okay, so very much important. 2 hours. If you don't have that much time, at least 1 hour, minimum 1 hour, you should practice these breathing. So 15 minutes you can divide and try to increase it, your practice. Okay, then Brahmari pranayam is work wonder for them, because they think a lot. What all the people who are having these issues, they think a lot. Sometimes this happen because of due to the stress. So if stress is triggering these issues, psychosomatic pain you are having in your spinal cord, then you require more breathing, which required relax, bringing the calmness, bringing the peace to yourself. So Brahmari pranayam you can introduce. Then meditation, Makar chanting, which I have discussed in the meditation class. Makar chanting, Pranav meditation. So these meditation you can include, and Yog Nidra we're gonna talk about it. So Yog Nidra also you can introduce to your students before sleeping. Okay, so they sleep well, and they can they require meditation. Okay, don't think that you can skip the meditation part. If you don't get the separate time of the introduction of the meditation, make sure along with the breathing practice, Like you can just use the breathing practice as a tool for meditation. Just tell them, okay, use your breathing and completely focus on the breathing when you inhale and exhale. That's also you can. But yes, introduce the meditation app. So these are the you can choose any one meditation and you can introduce to your class. Then Shatkarma. Shatkarma online, you are not learning about it, but offline we provide the lesson for Shatkarma practice. In Shatkarma, Kunjal Kriya, very good. Shank Prachalan. Kunjal is puking with herbal water. You can drink it and then you puke early in the morning, or with the salty water. Okay, I'm just giving you briefly idea about it. Shank Prachalan, where you're cleaning all it's a Virachan Kriya also. You clean a whole digestive tract. You drink the water and then you perform the certain asana, again salty water or herbal drinks also we give. And then we practice certain asanas and then you go for the poo. So water is coming from, you're drinking water from the mouth and then it's coming out from your anal region, right? You're going for poo. You keep doing that practice until unless water doesn't become not becoming white. It's not transparent and coming out from your anal region. Transparent water. So complete cleaning of the digestive tract. That also you can. It's work wonders, especially to pure to clean your body on the deeper level. Remember the Ama which we talked about. Ama is come out with the Kunjal practice and with the Shankrishna. Niti Kriya, yes. Jal Niti, Sutra Niti, Tel Nitis, Krit Nitis. We have the 4 types of the Niti. And again, you know the name. What these Nitis are, it's like cleaning of nostril. Why it is important? It is important for all the people. Doesn't matter whatever problem they are having, because it's allow your nostril to open. It strengthen this area. It work wonder to balance the all the 3 dosha, vat, pit, and kapha. Okay, but make sure these practice you should learn under the guidance of the yoga teacher. Okay, and the school which they are teaching about these things, not just by watching the videos you start practicing. Okay, these precautions you have to take it now. um, these, if you did it, it means you are curing the most of the diseases, especially the bone related issues, osteoporosis, arthritis, lumbar, back related issues. One thing you require whenever you have the spinal related issues, okay, spondylitis or the lower lumbar issues, you have to include the supine and prone posture and twisting postures. Okay, so supine and prone posture and twisting posture, and try to avoid the forward bend. Okay, so forward bending, you have to avoid till you feel you have the problems of those. And rest of the asana, there's a mini asana. I'll just give you one example. There's a locust pose, bhujangasana, cobra pose, all the variation of the cobra posture, and all the variation of the salabhasana are good for correcting your spine. Okay, and strengthening your spine. Then Markatasana for twisting posture is good. Okay, so these, I'm just giving you idea about it. Like this, you can make the sequence and introduce to your class, your student. So this is all about and the problems of back related issues, arthritis, osteoporosis, and spinal cord related issues. Please pardon. So we're gonna end the class here. So follow these guidelines and then most of the problem will be sorted out. But diet play important role, yes. And the breathing practice. If you ask me, What two most important things I have to include in my the whole routine is best. Okay, it gonna cure from the root level. Disease would be cured from the root level if they following the whole routine. If not, they cannot give excuses them to themselves for diet and breathing practice. These two are the most important. And yes, other things are important but secondary. Okay. So now the whole routine they have to follow. It doesn't mean then okay, two things I'm gonna follow, rest of then don't put blame on me that you don't get the good result. Okay. If you're following everything right, you listen to me, you follow rightly, then no way that you cannot treat your body. Okay, you definitely it gonna help you out. So let's end the session with the 3-time Om and Shanti. Okay. If still you have any doubts, any queries, you can write me down on Vinyasa mail ID and I'll answer in the coming session. I'll take those questions and give you the answer in while making the videos, while teaching. Okay. So let's end the session. Go into your posture. Keep your back neck straight, aligned. Gently close your eyes. Go into your asana. Now, once you are comfortable, take a deep, prolonged, slow inhalation, deep, prolonged, slow exhalation. Inhale and exhale with awareness. Now, inhale for the 3-time Om. Shanti. 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 Feel the vibration and sensation. Join both palms. Wrap your palm. Place on your eyes. Feel the warmness. Very slowly while blinking, looking at your palm. Gently open up your eyes with your mind of Shanti. Bless you guys.